Hi guys, Dr. Marquez here, Back Pain Relief Center. I have a longtime friend, Victor here. We've known each other since kids. He's been in more accidents than anyone I know. Just about anything that could go wrong with his back has gone wrong. Multiple herniations all over the place. In this case, a manual manipulation where we hear the cracks and pop would make him jump off this table. It would have been too much pain. It would exacerbate or aggravate his condition, and he probably wouldn't like me that much anymore. So with him, my goal is just to use a couple instruments on him and just get a little more mobility in the spine, and hopefully we can help relieve a little bit of his pain and help him manage this problem. So first, I'm just going to palpate through his back, see what segments are fixated, which is almost all of them with him. Just going to try to get a little mobility in there. Going to use an adjusting instrument. The adjusting instrument is just going to vibrate the joints, mobilize them, try to get them to set in place. Give them better mobility so he can function and feel better. We get a lot of patients that come in that don't want to be manually manipulated or cracked. That doesn't mean that you can't benefit from chiropractic care. There's many ways we can do it, and this is one of them. Just another instrument to vibrate the joints, break up some scar tissue, stop some scar tissue from forming. You give them better mobility. Kind of an industrial size massager here. Once again, to do some mild fascial release, just to loosen his muscles up. Once again, just for more mobility. Keep that leg straight, raise as high as you can. Good, and down, try the other one. Is that one harder? Yeah. His pelvis is a little misaligned. We're just going to realign it using a drop table. Okay, uncross. And that's it. Come on up.